station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
It's one of the best moments of your life when you welcome your baby into the world. The HSA's experienced women's health and maternity team provides the highest quality of care throughout your pregnancy and delivery. As a JCI accredited hospital, we are the leader in maternal care, safely delivering over 700 babies annually. Visit hsa.ky for more information. At HSA, we are committed to caring for you.
Welcome to the show. It is Bobo 103.1. Dane hanging out with you, and I am happy to do the show on a weekly basis. Once again, let me just run it down for anybody that's tuning in for the first time. This show is dedicated to all things HSA. Now, it could be any one of the department's specialties, medical field, doctor, marketing manager. Maybe there's a special conference that's coming up, a medical conference. One of the doctors or maybe the admin staff needs to know, make you familiar with. We've had the pleasures to have met so many different individuals across this field, in the medical field. Just quite recently, I think my latest one was the experience team. I had an interview with those young ladies, and it was really good because I never knew all this time. And I'm pretty sure the listeners also found out, a lot of them for the first time, that it actually is an experience team that exists in HSA. And they do so many different things that we just don't know about. Just see how complicated just a day-to-day operation is sometimes at HSA. I'm going to have the doctors introduce themselves here right now. We'll start with ladies first, and then we'll get a little background on you guys before we jump right into the interview. So go ahead. We'll start with females.
So my name is Dr. Karen Stewart. I'm the Director of Nursing, and I'm responsible for all nursing services, the respiratory therapy team, dietary, and today we are here as I was here the last time as a senior nursing officer talking about pulmonary rehabilitation. Now we're talking about pulmonology today. So glad to be on your show today. And I'm going to just move over now to Dr. Deepak.
Before you do move over to that, do you struggle with saying that word? Pulmonology?
No, I don't.
You don't?
No, it's fine for me. Yes.
My daughter was making fun of me because she was like, try to say it 6 times. Because I was like in the car, like saying it over and over. I'm like, how am I going to do this interview today? Because just the word alone is a struggle. But yeah, I'm pretty sure it's a complicated specialty. But we're going to hear from the doctor himself. Go ahead and introduce yourself.
I'm Dr. Deepak Muthreja. I have recently joined HSA as a pulmonologist.
Love it. Love it. Now, doctor, tell us a little bit about your background, how you got started in this field, the specialty, what, made you so intrigued to say, this is my field. This is what I want to do.
So, as you were mentioning that pulmonology is very difficult to speak.
Yeah.
So is the branch. And the lungs are very resilient organ, but they are also very complicated. If you cut through the lungs and calculated surface area, it's around 100 meters square. That is as big as a tennis court. So, and there is a lot of unmet needs in this branch.
Yeah.
And which actually motivated me to take this branch post my graduation in medicine.
Yeah. What made you want to become a doctor in the first place? Was it like in the family? Was it something that ran in the family?
I'm the first one in the family to become a doctor.
Does everybody call you ridiculous things like over the phone and be like, hey, I have a cold, but this is happening. Should I be concerned? Do you get those calls from family members?
Yeah, absolutely.
Yeah. See, our daughter is not even a medical student yet. She's about to be. And every time something goes wrong, we ask her a question like she's a doctor yet. But it's what we do. So we know we're going to be doing that as soon as she makes that happen. Now, okay, so I guess the first question I want to ask, is this the first for HSA, your specialty? Is this the first? Or you've always had somebody working in this department?
Yes.
Yeah, go ahead.
So pulmonology services is something that we have always done at the Health Services Authority. We had it for a few years because it's very difficult to get doctors of his caliber and specialty. And so we have had.
So is that the part that's missing? Is his specialty that's missing, right? Because you have a pulmonology department.
So we have a pulmonologist who does come to us on locum, but we wanted to have somebody in-house in the hospital, so that we can be able to have easy access to the services and not just wait for someone to come to provide the services. So Dr. Deepak being here is just wonderful for our patients, because now we can do and get services right away. We don't have to wait for somebody to come from overseas to provide that services. So now we have a full-time pulmonologist who's also a sleep medicine specialist.
Oh, wow.
So this is very good for us because we also do sleep studies at the hospital.
See, I never knew that. I had no idea. I mean, I've always heard there's different medical houses here in Cayman that does offer that services, but I did not know HSA actually did that. So you have explained to me how important that is to have at the hospital, because obviously you guys would have to wait for someone to come down to do this, right? So just how important is it for, let's just say, a patient or someone that has no idea? Why is it important for you to have the actual person on staff versus flying someone in?
So having a full-time pulmonologist actually enhance our ability to deliver this specialized respiratory care service without delays. Previously, some of our patients had to wait weeks or maybe have to be transferred somewhere else. But we want to ensure that we have this service right in our hospital, that patients don't have to be referred overseas or anywhere else. A lot of time, patients become very comfortable with the care that you give, and they want to continue all aspects of their care just where they are. So having Dr. Deepak now eliminates any possibility of somebody going overseas, because we're offering a lot of the services, or majority of the services, or all of the services that person may need right here at the Health Services Authority.
And it brings the cost down too, right?
It does, because guess what? Your family member don't have to go try and find a hotel or pay the air costs or anything. And plus, you have your family member here to support you, which is very important for all our patients.
Yeah, exactly. Can I ask you a question that may already be on the sheet, but I like to divert a lot of the time. So is this something that for those that, let's just say you're not a government worker, you don't work for a government entity, but you're listening to this interview and you want to take advantage of what's happening at HSA, can any insurance get you into HSA to use this service?
Yes.
Okay.
Yes, and most patients, you will find they would go to their GP, their general practice practitioner, or another doctor, and the doctor, based on their complaints, may think, I think I needed to see a sleep doctor, or I needed to see a pulmonologist, so I'm going to refer you. Then we are here for you. All you have to do is call us up and say that you have a referral. Can I come and see? And we will give you an appointment right away. There's no waiting time for Dr. Deepak's clinic, so we'll be able to get you in right away.
I love it. Now, guys, let's jump into the conditions treated. But before we do that, I want to break down for the listeners, for the first time, we're going to treat this like ABC and they're in their first grade in school. Just break down pulmonology for a second. Like, what is this? We say this word, it's fancy, it's difficult to even say for me as an on-air personality, but how incredible is your job and what do you do on a day-to-day basis?
So pulmonology is actually derived from a word breathing.
Yeah.
So I deal with patients' breathing pattern. So that not only includes diseases of your lung airways, but also sleep disordered breathing. So it encompasses everything related to the breathing. This is pulmonology.
And you broke this down beautifully last time when you came here too, because there was also a lot of confusion behind it, and you kind of gave a little bit of background on just things that you need to be concerned about. Now we have the doctor here, so we're going to talk in depth more. But yeah, she did a wonderful job when she came here and broke it down. I didn't even know that this was an area and expertise here at the hospital. All right, so what are the most common breathing issues that we can discuss this afternoon on the radio show?
So we regularly see patients having COPD and asthma. These are the airway disorders which are frequently seen. COPD, the most common cause being smoking, while asthma is mostly allergic. These are the airway disorders which we see frequently. Then comes your pulmonary infections, pneumonias, which are also being dealt in the dealt by the pulmonologist. Then your parenchymal disorders means the lung disorders. Now, since everybody is aging, lung also age. Similar ways, they have lung fibrosis
Yeah.
as they age. Post-COVID, we have seen a lot of patients having lung fibrosis. We see a lot of interstitial lung disease. We see a lot of bronchiectasis patients. These are the parenchymal abnormalities which we deal with. Then comes the next part, which is sleep medicine. Sleep is very important part in your life. It actually helps you regenerate your body cells. Your body requires at least 8 hours of sleep in a day. So 16 hours you're awake, 8 hours you're asleep. That is the time when body goes through various changes, and it gives our cells time to repair themselves and be ready for the next day.
What if somebody's like, and this is a question for a friend, right? What if somebody's constantly waking up, right? They're getting that 8 hours of sleep. Rightfully, they went to bed, let's say 8 o'clock. They usually wake up at 7, right? And they're getting up in between sleeps. Is that disturbing the revival of? Okay, so it is.
Yes.
Or so it is.
You should not have a fragmented sleep. It is called as a fragmented sleep.
So is somebody supposed to be sleeping right through the whole entire night for a good sleep?
Yeah.
Oh, wow.
And you go through many stages in sleep. Sleep is, we think sleep is only a single physiological structure, but it's not. You have to go through a lot of sleep stages, from awake cycle till N1, N2, N3. Then there's one more thing which is called as REM sleep. So you should cycle between all the stages of sleep so as to have a good night's sleep, what we call it as.
Yeah. Wow. I never thought about it that way. And what are the seriousness if somebody's not getting enough sleep? Can we discuss that?
So
Yeah.
if you have a fragmented sleep or you are not having enough sleep, your cognition level goes down. You cannot comprehend things. People cannot work properly. And mind it, if patient is having sleep disordered breathing or OSA, if they drive their vehicle, they fall asleep on the wheel, and that time they meet with a lot of accidents. We have seen quite a few patients who have been who have gone through many accidents, and they have landed up in ICU with different broken bones and RTA fractures and even head injuries. But the basic cause was sleep apnea disorder.
Let me ask you now, doctor, personal for us here at the radio station, if we come to work if we're leaving our house around 5:30, so we're up at 5, right? What time should we be considering sleep time for us as on-air personalities?
So at least you require 6 to 8 hours of good sleep.
Yeah.
So if you're waking up at around 5 o'clock, you should sleep by max 11 p.m.
Okay, that's good. That's not too bad. I thought this doctor was going to drop 8 p.m. on me and 7 p.m., which was going to be a terror. But guys, last question before we go into a quick break. How do you approach and manage chronic disease here on the island along with asthma and COPD?
Right. So now we are talking about the airway disorders. For that, we see the patient once they have the symptoms, like they feel breathlessness or they have allergic symptoms. These patients undergo certain tests, which is very simple, which is spirometry or a pulmonary function test, in which the patient requires to blow in a computer, and computer senses the lung volumes, and you get a report whether the patient is having COPD or asthma. And then these patients are managed with the help of inhalers and certain anti-allergic drugs.
Okay. All right. So listen, if you're just joining in for the first time, we are here discussing a very important topic around pulmonology here on the island. And just it's not a new specialty, but obviously a doctor has been hired full-time in that area. And we're going to discuss this more, break it down. If you got any questions, we urge you for next time. That way we can send it off to the doctors and the department. If we do not get any questions answered here on the show, we always like to hear from you, right? So you know our social media. It's Bobo 103.1. You can find us on Instagram or Facebook. We're going to take a quick commercial break. And when we come back, we'll break it down more. We'll talk more on the specialty. We'll talk more about the doctor and just things that you can expect on the specialty and what you can come in. We discussed insurance needs already. And if you can use your insurance, especially if you do not work for government, is it allowed? We've already spoken about that. So when we come back, we'll dig deeper in. Keep it locked. We're Bobo 103.1 FM.
Your Cayman Islands Health Services Authority has been the national healthcare provider of the Cayman Islands for many generations. We have elevated our level of care to ensure you, our patients, have the best possible experience. We offer better access to care close to home with the most locations on all 3 islands, delivering a full range of primary, secondary, tertiary, and emergency care. HSA is a JCI accredited organization, and we are committed to caring for you.
All right, we are Bobo 103.1 FM. Welcome to the show. It's Dane hanging out with you, and it's always my pleasure when I get people that are way smarter than me coming in the studios to talk about very important topics around medical. And this is a show that's dedicated all things HSA, and we have some special guests in the studios. I'll have them do as I always do. We have new listenership, people that are just joining in, coming in the car for the first time. You may be streaming us on our website for the first time, which, by the way, is stingraymedia.com. You can go on there and stream us live or download the app on your iPhone or Google Android phone. If you use that, I won't hold it against you. But you can go to Google Play Store in order to download an app by the name of TuneIn. So that way you can take us wherever you go. So if you ever want to hear this segment, even if you're traveling overseas, Miami for the summer or Europe, wherever you go, you can bring us and take us along with you so you never miss a beat with these conversations. All right, so guys, I'm going to have you introduce yourself again. I know it sometimes can be a little bit of a pain, but we have new listeners in the car. So we're going to have you guys just go ahead and introduce yourself one more time, starting with females, obviously.
So my name is Dr. Karen Stewart. I'm the Director of Nursing Services, and I also oversee the respiratory therapy services, as well as the dietary services and patient experience services. And I'm very happy to be here with you.
It's a pleasure to have you back. I never forgot you guys when you came back, and you definitely gave an in-depth conversation around this topic. So excited to dig deeper and more. So we do have a new doctor appointed to the HSA, so we'll have him introduce himself also.
Hi, I'm Dr. Deepak Muthreja. I'm a pulmonologist, recently joined HSA.
Doctor, I mean, this can go to anyone, to be honest with you, but what role does early detection play in managing lung cancer?
So, lung cancer, as we all know, in the world, it is diagnosed at a later stage. You always see lung cancer at stage 3 or stage 4 because lung is very resilient organ, as I mentioned earlier. But then, diagnosing lung cancer at an earlier stage will not only give you a quantity of life, that it will not only prolong your longevity, but also it will give you a good quality of life. We can, if we diagnose lung cancer at an earlier stage, we would be curing the patient of lung cancer.
Yeah. That's big. Anything else to add on to that? Do you want to? Yeah.
No, I agree with the doctor. Early detection is important. So we are here for you. Come and see us. Doctor can advise you of the tests that you would need to do to make sure that you're clear. And if you're not clear, we can advise you as to the next step.
You know what's so funny? Because a lot of people, this is the reason that we push early detection, right? There's a lot of people that's walking around that don't know that they have a disease like this, right? And a lot of the times, you're fine. You're completely fine. As a matter of fact, a lot of people that I've heard that they found out for the first time they have cancer, they said, but I'm okay. I don't feel any type of way, right? So I want to ask you guys, what are the signs to know if you even have lung cancer? But is there a sign? Does it feel? Yeah, go ahead.
Yeah. So actually, the symptoms starts with like cough and breathlessness.
Yeah.
These are the certain symptoms if a patient who is a smoker and he has cough, breathlessness, or blood and sputum. These are the early signs which you will find in the patient of lung malignancy. Also, we can do a annual CT scan for patients of COPD. This can detect the lung cancer at an earlier stage. So not only the sign and symptoms, but also the regular follow-up, regular checkup with your doctor can help you detect this lung cancer at an earlier stage. We can biopsy it. We do have services like a contrast enhanced CT scan, a whole body CT scan, which will also tell about the spread with the help of bronchoscopy and other modalities like endobronchial ultrasound. We can make sure that patient is staged properly and goes for a proper therapy with a comprehensive treatment like a pulmonologist, a medical oncologist, a surgical oncologist, all together can give benefit to the patient.
Yeah. And what are the treatment looks like for this? Like if you're going through a treatment, you found out sad to even bring this up, but if anybody finds out for the first time, well, I have it. Like, what
So-
do your treatment looks like?
If it's stage 1, stage 2, or early stage 3, one can offer patient the surgery. This will actually give patient a good quality of life later on. But if patient is diagnosed at stage 4, still the patient should not lose hope, because we have therapies which are called as targeted therapies, newer monoclonal antibodies, new immunotherapy. These therapies actually don't have any kind of major side effects,
Yeah.
which we are very concerned when we are putting a cancer patient on a chemotherapy, but they have a good quality and quantity of life later on.
But you said good stage of, like, you obviously have a good life moving forward, but like, what does that mean? It's like, because when you're having surgery, or if somebody's losing their vocal ability at all, is this just a simple surgery to remove the cancer? Is that all it is? Because I've heard rumors before that people do lose vocal cords, like they can't no longer talk, or when they do talk, it's a little bit harsh or weird. Sounds like they're on cigarettes, and yeah.
So for lung malignancy, if we are diagnosing it at a very, very earlier stage, there are options which is called as lung sparing surgeries, in which you can do a sleeve resection. That means only a part of lung which is cancerous,
Yeah.
to remove that. Or if patient goes for complete lung removal, then also patients like will have some problem post-operatively, like pain would be there for a couple of weeks, I'll say. But then the morbidity or the problems are far more less than having a stage 4 lung malignancy. I had a couple of patients whom we operated at a very earlier stage. They are still doing well.
Yeah.
They're living their life to the fullest. They're
Yeah.
traveling whole world. So we need to understand that you don't have to be afraid of the complications, or you don't have to be afraid of the morbidity which the surgery will bring, but the quality of life and the longevity of life what the surgery will give it to you is more to be concerned of, rather than its side effects, I'll say.
Yeah, that's a good point. What I want to talk about now is something that I care deeply about, because I always feel like I have sleeping issues. So I like to dig into these stories because maybe they will educate me a little bit to see if it's that drastic for me. I remember during COVID, I had a friend that stayed over my house. It was a good friend of mine. But I realized, both me and my wife realized, a lot of the times when we used to come downstairs, because we were either leaving to go and do something that was very important, the way that he snored was a little bit different. It was very, we kind of made fun of it at first. And then it really took me back when I asked him one day, hey, can you take me somewhere? Because I may need the car to come back up here, right, to the house. I spent the greater good of, I think, 20 to 25 minutes waking him up. It took me about 25 minutes. I kid you not. And this is an individual, if you were to call him, like how most people can hear the phone ringing, he will not. So he kind of broke it down to me, and he said that he had sleep apnea, right? That obviously he suffered from this. It was a sleeping disorder. And I kind of want to know, maybe I'm not explaining it right. Maybe that's far from what part of the condition is, or maybe it is. But I want, for anyone that knows, hey, am I suffering from this? What are the signs?
So first of all, the spouse complains a lot. It's not the person, because he doesn't know what is happening in his sleep.
Yeah.
The spouse tell that the person is having snoring difficulty breathing during sleep. Then they have snoring. Many times we attribute that if the person is snoring, he is having a deep sleep. It's not that. It's a
Yeah.
fragmented sleep, because you are actually craving for air, and that's the time you are snoring, because your airways are blocked or choked, and you are actually trying to take the air in, and that is making a turbulent sound or a snoring or a snortling sound.
So this is literally for everyone that snores. This is
Yeah.
somebody that's like really trying to fight for air.
Yes.
Wow.
So
This is insane to learn this, because that's what everybody thinks. Like when you're snoring, obviously, he had a hard day today at work. He's getting all the sleep that he needs. He's in a deep sleep right now.
no, it's
Wow.
it's a fragmented sleep.
Oh man.
So, and this is one thing. Second is craving for breath. Many of the spouses who come down to us, they tell their husbands or their wives, stop breathing at night, and then they have to awake them up so as to ask them to breathe. This is the second symptom what we frequently observe.
Yeah.
But then suppose a person is living alone, doesn't have a spouse. So what are the symptoms which are attributed to the sleep apnea? These are early morning headaches, tiredness throughout the day, like craving for sleeping everywhere, dozing off while sitting. So suppose we are talking now and suppose someone doze off, it means that he might be having sleep apnea.
There is no way that somebody's going to fall asleep in the middle of a conversation like this.
So,
There are people that are doing that, like in the middle of a conversation like this.
Yes, in the middle of conversation,
Wow.
while someone is speaking. I was having discussion with Dr. Karen as well yesterday about one of my patient back in India who was actually a judge in the court of law. She used to fall asleep while the attorneys were conversing about a case.
Wow, that is so bad.
So, but then once we treated her, she was fine and she still thanks me.
Well,
That-
I hope she does.
Yeah, that she also got promoted after that, and she retired as a high court judge.
Wow. Now let's talk about obviously resolving and fixing this. Obviously, there is a way to get this under control, and I think you're the right man to kind of explain what do you have to do. First of all, if you're hearing this interview for the first time, you say to yourself, "I need to get checked out." He's explaining everything that I go through, so I definitely suffer from this. What are the steps? First of all, if you are identified as a doctor, you're talking to your patients, and you identified that you do have sleep apnea, how do you deal with that?
So, first of all, if the patient is coming up with the symptoms, we have certain calculators which is available online also for the patients, that they can themselves see whether they are having sleep apnea or not. It is called a stop bang questionnaire. That can be easily used by the patient to know about whether they are having sleep apnea or not.
Okay, and then
Right.
so you guys use it. Okay, go ahead. Sorry.
After that, if the patient is at high risk for sleep apnea on stop bang questionnaire, we subject that patient on sleep study. So there are multiple levels of sleep study, starting from level 1 to level 4. The apnea study is now getting simpler and simpler. Earlier, you have to have a lot of cords attached to you. You being hooked to complete machine.
I've
and
seen
then,
that.
Then only you will be able to diagnose sleep apnea. But then with the level 3, we can easily do that patient doesn't have to be hooked on so much of machines. Because the difference between level 1 and level 3 is that the level 1 will give you elaborate information about your sleep.
Yeah.
But for diagnosing simple obstructive sleep apnea, level 3 is enough. And after that, you have to explain the patient what do they have and what we see, how many times he is stopping breath during the sleep. And after that, the patient is put on different devices, ranging from the CPAP, which is the most prominent and most promising treatment for the patient.
Yeah.
Later, they have surgeries or mandibular advancement devices. These are the all treatment modalities which is available for the sleep patients,
So
sleep disorder patients.
So some people have to have surgery for this.
Suppose they are not willing for going for a CPAP machine.
Yeah.
Yet there are curative surgeries available, like uvulopalatoplasty, what we call it as. But then it might happen that these patients don't do well with these surgeries as well.
Yeah.
So the best treatment today, if you ask me, it would be the PAP or positive airway pressure treatment. That is applying a machine at night so that a person sleeps well at night without any fragmentation and gets up early in the morning fresh and can do a lot of his course. The other part of the sleep apnea treatment is lifestyle modification.
Yeah.
Like you mentioned, that if a person is getting up early in the morning, he has to see that he is getting a 6 to 8 hours of sleep properly.
Yeah,
Right.
I know you said that was the best one when it comes to the machine. But let me ask you while I have you here, is it a comfortable one? Because I think about a machine and I'm saying to myself, the way I toss and turn, that would not be comfortable for me.
So, as with everything, you need to have some time to get adjusted to the machine,
Yeah.
right? For first 7 to 15 days, the patient does feel uncomfortable.
Yeah.
because of the pressures. And also we as a doctor need to understand what pressures to give to the patient.
Yeah.
Right. Suppose you are giving a lot of pressure to the patient will not sleep because he will have problem during exhaling.
Yeah.
So by inhaling, if you're giving a pressure, it's fine. But while exhaling, if you're giving a pressure, the patient will get up. So for first 2 weeks, I'll say, it's like a war between patient and the machine.
Yeah.
But then after 15 days, once the patient get acclimatized to the machine and the machine gets acclimatized to the patient, they have I'll say they have a very beautiful life.
Yeah.
I have seen that.
Yeah. Which is important, right? You gotta learn. I was just saying that to my kids. That usually the things that make you feel uncomfortable is what is usually good for you. But yeah, so we've dig deeper into obviously to know the signs if you have sleep apnea and when do you need to go and see a doctor. I think just the important part to ask, the very important question is obviously if you do not take care of this, if you do not treat it, if you do not go and get it, especially if you're told that this is something that you suffer from, what are the end results for you?
So suppose patient is left untreated.
Yeah.
That time the patient will have fluctuating blood pressures. They have what we call it as accelerated hypertension. Their blood pressures are not controlled with any amount of medications. Then they are predisposed to uncontrolled diabetes. They are predisposed to multiple admissions for heart failure or heart rate irregularities, what we call it as arrhythmia.
Something you definitely don't want to hear.
So,
yeah.
So all these conditions are actually related to your sleep disorders. We see frequently patients getting admitted again and again to the ICU for heart failures, but when we evaluate them, they actually have sleep apnea disorder. So if it is left untreated, it has a lot of problems, not only medically, but also patients have cognitive disturbances. Patient cannot work properly. They are not very productive in their whole life. And also the social things are different, like what you mentioned about your friend.
Yeah. Just simple things like I know this is for a lot of people, they would not believe me if I told you the story, but the individual, I think he's comfortable because me mentioning this because I brought him on the radio before and we spoke about it. And he wanted to kind of educate people. That's why he spoke about it for. And I think the number one reason he wanted to educate people and he said he needed to get help was when he found out, little bit of a sad story here, but he lost his mom, right? His mom passed away. He was not able to attend her funeral because he was not able to get up. He was not able to wake up. That's how serious it could be. From my side of explaining it to you, if you feel that you're suffering from this, just realize that this does take away a lot of the crucial things in your life if you're not taking care of it. Like imagine missing your mom's funeral because you did not get something like this paid very closely attention to, or you get what I'm saying, guys. Like it's just one of those things where I don't think you understand just how drastic it can get because like I said, we woke him up for it was a very long time. I was concerned at one point, but then I think it was the sound of how I was hearing breathe. That was more concerning to me, right? So, but yeah, make sure you go and check the doctors out and get checked up. Early detection is always number one. This is what these guys strive for here at HSA. We're going to take a next commercial break. When we do come back, we'll ask some more questions. Once again, guys, I want to urge you to use our Instagram page. You can send us a direct message if you have any questions at all that you would like to send to us. Just go to Bobo 103.1 FM, Boat on Facebook and Instagram. We'll be right back.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome back to the show. We are, of course, Bobo 103.1 FM, and this show is dedicated to all things HSA, and we've been doing this a while. This has been around for a while, and we get so educated, we get so much knowledge about what's taking place behind the scenes at HSA. Some of the things that you just did not know about, and you see how incredible what's going on behind the scenes, the departments, the specialties that are taking place, and what is offered to you. I dare to say that we are now considered, when it comes to medical here on the island, we can consider ourselves first class. We're very much ahead of what a lot of people are doing around the world. And I am proud that HSA is actually stepping up to the forefront. And this is the one-stop shop for everyone when it comes to medical needs. I'm going to have the doctors introduce themselves once more for anybody that's tuning in for the first time. And this is pretty much our last segment. We're going to ask some very detailed questions. But if you have anything else that you would like to ask, we always urge you, use the Instagram, use the Facebook. We can personally pass it on to the doctor. That way they can get back in communication with you directly. All right. So once again, that is Bobo 103.1 FM on Facebook or Instagram. Start with ladies first. Go ahead and introduce yourself again to the listening public.
So my name is Dr. Karen Stewart, Director of Nursing Services. I also oversee the respiratory therapy department, as well as porter in dietary and patient experience. And I'm so glad that I'm here with you.
Love it. Go ahead, doctor.
I'm Dr. Deepak Muthreja. I'm a pulmonologist, recently joined HSA.
Now, let's talk, guys. Let's dig deeper into the full range of services that you guys offer at HSA, especially now that you have a full-time pulmonologist on board. What are some of the services that you guys offer and different tests that are available to patients? Yeah, anyone that wants to answer that, they can jump into that.
So at HSA, we are doing the sleep studies, we are doing bronchoscopies, we are doing pulmonary function tests. These are the tests which actually helps us to diagnose all the airway disorders, lung disorders, as well as sleep disorders.
Okay, I love that. Yeah, we did explain that earlier too. Go ahead.
Yeah. I just want to add that we do have a sleep lab as well. Very nice. So for our level 1 sleep studies.
Mm-hmm.
And as you know, in December, we launched our pulmonary rehabilitation program. So now we have a full-time pulmonologist. So we are bringing the entire respiratory care service, entire pulmonology services to you. So not only are we here to diagnose, intervene, and provide really good treatment plans for you, but we are also here to make sure that if you need rehabilitation, such as having COPD and your quality of life need to be stepping up, so we have pulmonary rehabilitation as well to help you to improve that quality of life.
I love that. And that's just some of the services that are offered there and the full scope of it to just summarize for you all. Guys, I'm going to struggle a little bit with this one, but I'm dying to be educated. What is, do I break this down as an analogy here? EBUS, TBNA, and how is it used?
All right.
What is it?
So it is actually endobronchial ultrasound. And TBNA is transbronchial needle aspiration. So in that, this modality is preliminary used to stage lung malignancy. Also, it has a ultrasonographic probe which is attached in the front of bronchoscope. And with that, you can see the mediastinal structures. These are the structures which are actually around your airways. It is not inside the lung, but it's outside the lung, but around your airways. And these things you can biopsy well with the help of this neurobronchoscope. And then you can give the patient the diagnosis and you can stage lung malignancies as well.
Okay, wow. All right. So didn't know that one before, but this is what this show is designed for, guys, is to be educated. We're going to dig deeper. I know that you said earlier you had areas in the hospital where you can conduct sleep studies. So I want to ask this question. How are the sleep studies conducted at HSA? How is that done? Because you did say that there's areas where you can conduct that. Yeah.
Mm-hmm. So maybe your physician, based on your, as I said, you may visit your GP or another doctor, and based on what you are talking to your doctor about, they may say, you seem as if you need to do a sleep studies. So they may refer you to the pulmonologist or the sleep medicine physician, or maybe they order for you to do a sleep studies. Once you come to us, then the pulmonologist will determine, is it a level 1 that you need, level 2 or level 3. Now the level 1 sleep studies is done in the hospital. It's where we put you in a nice 1-bedroom, with your own conveniences, and we prepare you to sleep overnight in the hospital while we are observing you. And then the next morning you get to go home.
How does that as a radio personality, I gotta stop and I gotta ask, how is that observing done? 'Cause that can be a little bit creepy at times.
So actually, we don't. We're not in the room there with you because we need to make you sleep well.
Yeah.
So, but we do have a camera in the room, so we can stay on the outside and do not disturb your sleep.
Okay.
So all we're observing through the camera is just how you sleep, and we do have machines that is set up on you, and those machines give us certain traces, and we're able to interpret those traces, and from those traces, the doctor will diagnose, what is happening with you. We also do have level 2 and level 3 sleep studies, which is done at home. So the patient will come to us. We prepare the patient, educate them. They can go home, put these things on. For level 2, we may have to go into their homes to help them. And then they will just sleep. We are not there.
Yeah.
They're able to sleep in their comfortable bed, which is really good because it's where you're comfortable. And the next day, you'll just bring in that machine. And then we're able to download that. We're able to just read that, score that studies, and of course the doctor will be able to interpret, and then he'll be able to diagnose. So those are the different types of sleep studies and sleep studies that we do. Most patients, like at least 95% of the patients, tolerate that.
Yeah.
Very few patients we have that says, no, especially level 3, because they're at home.
Yeah.
And so they're in the comfort of their house. And so that is what we do. And then based on the doctor diagnosis, then he will decide what are the options. And we do have the dental option as well, but that depends on the level of sleep disturbances that you're having.
Yeah.
And that is where Dr. Deepak will come in, and he will make that decision, based on what he's seen on that studies.
You meet a lot of stubborn customers at times, and a lot of them would I know you guys wouldn't refer to them as that, but I think I'm allowed to. But if they, especially with AI now being one of the biggest things around the world, and so much investments are being done, people are saying, okay, well, I don't think I need this. My Apple Watch is telling me I'm just fine. So what do you guys say back as doctors, as experts, when somebody looks at you and says, well, my Apple Watch is telling me I sleep just fine?
So I'll take this question.
Yeah.
So Apple Watch, recently I came across that US FDA has given approval, but that is a level 4 study.
Yeah.
So in that, it's not AI, but it actually does what we call it as PPG, is positional plethysmography. It actually evaluates your sleep disordered breathing according to the changes in your arteries, capillaries or vessels. These are the tubes which carry blood in our body. Mm-hmm. And according to its color, it actually calculates number of times you have stopped breath during the night. And we get an arbitrary level of the sleep apnea. But this is not a gold standard method. Suppose by using Apple Watch and I prescribe a patient a sleep machine or a CPAP machine and he's not tolerating it, anyhow I will require that patient to undergo a complete sleep study.
Yeah.
So as to see not the arbitrary values, but the actual values, how many times he's stopping breath at night, how many times his oxygen saturation is going down at night. So yes, it can give us an idea whether the patient is having sleep apnea or not, but it cannot be used for diagnosis.
Yeah, I love that. I love that message. It's true. I mean, you can use it as a tool, but it shouldn't be the official way of saying, yeah, this is it. I know I'm okay because of my Apple Watch. Be very careful, guys. Still seek expertise in doctors. That's why they're here for. Talking about that, I want to say that this was mentioned before, but as usual, because of our new listenership, I would like to ask for those that want to know, okay, I need to go and get checked up. I love everything I'm hearing here. So do they have to get a referral from a doctor, or would they have to speak to in order to see Dr. Sorry, what was your name again?
Dr. Deepak.
Dr. Deep, yes. How do they get to see you?
So I think
most times, most times it will be because they have seen their own doctors, their own general practitioners, and because of what they're saying, they'll want them to get further checkup. because pulmonology and sleep medicine is a specialist. It's a specialty study. It's a specialty area. So most time persons will want to. Maybe you go to urgent care.
Yeah.
The doctor might say, no, this you need to see somebody to do a little bit more deep diving. Maybe you went to accident and emergency. Maybe you went to your GP, and all of that is happening, and so they have to refer you.
Yeah.
So it's very simple to just call the specialist clinic and just ask for an appointment. We don't have any waiting list. Dr. Deepak is in the clinic for most of the week, so you will get through very, very quickly. So just want you to know that the service is available and there is no waiting list. So come on down, call us at the HSA 949-8600, and we'll put you on to the right person to make that appointment for you.
I love that. I love the no wait list too. That's a big thing, and especially for their listeners that are listening, I think that's something that they were used to in the past when it comes to HSA was just a wait list. So that would always put them in fear, and they probably would go to a private doctor because of that. How many patients do you see on a regular basis, doctor?
So since I've joined recently,
Yeah.
I'm actually seeing around 8 patients a day.
Okay, that's good. That is good. And that's why there's no wait list, because you're actually powering through your whole entire day. So let me ask this question now. I want to keep it at one because we do know what smoking can do for your impact your lungs, right, and your breathing. But new studies have actually shown what vaping is causing amongst young people. And I kind of want to target vaping on this conversation, because I think it goes without saying, smoking is bad for you, and people know that. But I think a lot of people are turning to vaping because they feel like this is a safer form. Nothing can happen to me because of vaping, and that's why I took it on.
So it's a myth that vaping is less dangerous.
Yeah.
It is as dangerous as smoking. I've seen people going for severe lung failures, like lung injuries, because of vaping. So it is as dangerous as smoking.
Yeah.
One should not think that the vaping is like a less harmful form of smoking, but then it does harm a lot to your lungs and airways.
And what do you say to a parent now that's listening that knows that their kids are doing this? Obviously, I've heard so many horror stories that their kids are at school, they're going into the bathrooms when they're out and about, and their parents are not around. If there's a student listening right now, can you explain some of the serious health conditions that can happen if you do not stop the vaping?
So with vaping, it injures your lungs similar to what smoking does. But then later on in your life, you might trigger pulmonary fibrosis with vaping. You might trigger COPD.
Yeah.
Because anyhow you are inhaling a noxious agent, right? So vaping has a similar effect of smoking, except the tar is less, but then it also predisposes to lung malignancies as well in the later stage of life.
Yeah, you just got to be careful. I always educate my kids on this. You don't even have to think that your kids are doing this. Have conversations with them early about vaping, because one of those conversations I'm extremely passionate about, and I hate to see it amongst young people. And always the excuse is, it's safe. There's nothing wrong with it. Yeah, go ahead.
So I just want to encourage the listeners that if you know of someone who would like to stop vaping or smoking, we do have a public health smoking cessation program at the HSA for anyone who is using tobacco or vaping products, or anyone who you're concerned about who may not know about the program. So I'd like to invite you to visit www.hsa.ky. You will find more information on it. And as I said, it's a public health initiative, so it's usually free.
Yeah.
So all we need you to do is just show up.
Yeah.
Call us, let us know that you're interested, and we will guide you to when the program is commencing, and also bring someone along with you who you're concerned about. Maybe having a partner, it will be quite helpful.
I love that. All right, guys, we're going to wrap up with a very important question, one of my favorite questions to end the show. And now we have an official doctor that's a part of this department. What is the vision in the future, of course, for your specialty here on in HSA? Why do you guys see this look in the next 2 or 5 years when I interview you again, probably next month?
Well, we continue to expand our services. That is why we have a very expert, experienced, and very very good, excellent a pulmonologist who
Yeah.
also does sleep. And that was very important to us to really get someone who also do sleep because of the large population that we have with undiagnosed sleep apnea.
Yeah.
So we, as I said to you, we have just launched the pulmonary rehabilitation. It's going really good. Our patients really love it. And we brought that on late, not even because doctor was coming, but because we realized that we have to also provide that that service that will help our patient to increase their quality of life. So we continue to expand our sleep services and also our communication education. And one of the things that we're doing this for is to reduce the number of patients who are inconvenient with having to go overseas.
Yeah.
You know, no family support when they go overseas. So as doctor has said, we have invasive pulmonology tests that we can do to make sure that we can diagnose and do early treatment, early diagnosis, early treatment, and early recovery.
Yeah.
Also, doctor will work in the intensive care unit. Sometimes we do have patients who are on the ventilator. They're on these life support machine, breathing machine. Now we have a specialist, a pulmonologist, who could do a simple bronchoscopy right at the bedside, where you take a videoscope, like a picture of the inside of the lung, and can diagnose and get you off such machines. So therefore, the service, it just offers us quick and easy and early diagnosis and intervention. We care for you, so therefore we are bringing the services to help you. We want you to breathe easier.
Yeah. I love that. Guys, can we give the number once again? Any last minute? Let's do a quick wrap up. But any last minute things that you guys would like to add, one before the interview is done, and can you also just add the number and how they can get in contact with you once again?
So the basic purpose of pulmonologist service is that make patient breathe easy, as it was earlier mentioned. We can diagnose diseases ranging from asthma, COPD to lung cancer, interstitial lung disease, which are very debilitating. Not only that, sleep apnea can be treated, and if the awareness about sleep apnea increases, patient will have a rewarding life, will have a more productive life.
Yeah.
Because as we know, we are aging, lungs to age, but we can intervene at an earlier stage regarding all the diseases, including lung cancer, and give a patient a good quality of life.
I love that. All right. And number, of course, just to get in contact. And your last minute wrap up too.
No worries.
Yeah.
Thank you so much. So I just want to remind our listeners that do not ignore persistent signs and symptoms. Yes, if you're coughing, wheezing, having shortness of breath, not understanding what is happening, your lung health is vital. And so early intervention can prevent long-term damage. We are here to help you to breathe easier. And so if you find that you need the assistance or the services of the pulmonologist, feel free to call us at the Health Services Authority. You can call 949-8600 and ask to make an appointment. And we, as I said, there's no waiting list. We are here to help you. We care for you. So don't be afraid. Pick up the phone or ask your physician if this is right for you. And so let your physician as well guide you.
I love it, guys. Thank you so much for being a part of the show today. We really felt like this conversation was intriguing, and there was a lot that was learned. And I hope that you guys have an overwhelming amount of calls that come in to your department, because trust me, it's people just learning and taking care of themselves and putting themselves first, which is important, right? Until next time, thank you so much for being a part of the show.
Thank you.
And once again, to the listening public, this is all brought to you by HSA. Thank you so much, guys.
Thank you.
you.
Have a great day.